I love working at the surgery because I think every day is different.
There is no God anymore.
Mary, don't give up your faith, OK?
The best thing about being a GP is making a difference in people's everyday lives. OK, sorry, I might have just ruined your hair.
It's fine.
Patients here are fantastic. They keep you on your toes.
Don't think I'm that crazy, yeah? I'm not into that stage anymore. Don't make me a psycho.
I've had a good life. I've got 2 beautiful daughters, 2 beautiful granddaughters, and a great grandson. If I died tomorrow, I ain't got no complaints.
Hello, Fanamo Surgery. We need to speak. How can I help?
Come in, Mary.
What are you doing down here?
I've been sent into... It's like being sent to Coventry. So I'm looking at your finger again, is that right? Which one is it? That's a giveaway, isn't it?
The morning is the worst time. I would like to give you praise, because to me you're not David Ward, you're St. David.
OK, well, that's very kind of you to say that. But I think the saints may feel that they're being reduced in stature if I'm elevated to that level.
You're in my estimation anyway, you are... That's my opinion of you.
Well, that's very kind of you to say that. Now, listen, yeah, you've had one on each hand. Are you happy for me to do it again?
I'm happy with you to go ahead. I'm going to leave it till last. But I'm going to tell you now, you know the X-ray you sent me for?
Yeah.
He was kind enough to refer me to Exon Park.
OK, yes.
Because his words to me were that it's 8 years since I've had the tumour removed.
OK.
And his words to me were that it could...
Keep talking, I'm just going to get this ready. Yeah, keep talking.
It could be the cancer come back, but it had gone to my bones. And I went in and I seen Dr. Hale. She introduced herself and she said, I'm a cancer doctor.
That's very good service, isn't it?
So she said, it's very unlikely that it's cancer.
Yep.
But she wants those bloods and the MRI done before I see her next week.
Yep.
I mean, OK, I'm lucky. It's 8 years since I had it.
Yep.
I didn't even have to have chemo.
No, that's right.
Do you know what? My oldest son, he turned around and he said to me, there is no God anymore.
Well...
And I said, you know, Tony, I'm having second thoughts.
Mary, don't give up your faith, OK?
You bought chocolate. Always. Oh, I love you. Bit of chocolate in the morning never hurt anyone.
Diamantino Pereira. Hiya.
My problem is, for my age, I am missing quite a lot of hair.
OK, so when you say you're missing quite a lot of hair, what do you mean?
There's a lot of hair.
OK.
It's missing a lot since more than 1 year.
Is it only when you brush it and wash it, or is it just falling out? You're noticing that it's just...
No, it's just falling out. Sometimes when I do this, just put my hair straight,
Sure.
3, 4 come on my hands.
OK.
Every time.
OK.
And it's quite nerve-wracking, you know.
OK. So any ideas what you might think is going on?
I got a depression from the school.
What?
Depression.
Depression, OK.
Yeah, from school. You take medication too.
OK. Any family history of sort of hair loss or what we call vitiligo with the...
My dad, the back, but...
OK. Oh, is your dad a bit old now?
Right now, I just touched it and one came in my hand.
OK. Hair loss is not very common in teenage boys. However, it can occur in some situations. The most common cause of hair loss is male pattern baldness. This can actually start developing after puberty in late teens, early 20s. Other causes are alopecia areata, psychological emotional stress, thyroid conditions, hairstyling and treatments. Can I just have a look at your hair, first of all, see what's going on here? Okay, so you don't have any specific patches where it's all kind of come out in one sort of bulk, but yeah, it's a little bit thin in some areas. Okay, sorry, I might have just ruined your hair.
It's fine.
Okay, so I think sometimes if you're low in iron, that can cause you to have sort of hair loss. And yes, sometimes stress can have an effect on it, okay? And sometimes it's just one of those things, you know, the hair grows in cycles, and sometimes it just means that the cycle is all at the same time, so it appears that more's falling out than normal. But the first thing we would want to check is sort of iron levels and see if that's a possibility, because like you said, you're growing, so it may just be like that. What's your diet like?
Diet, yeah. Salad, fruit, yeah.
We eat a lot of salad.
Yeah, I'm not a very normal kid. I like the healthy stuff.
Okay, so your diet seems like it's good, but you are growing, so sometimes these things can happen. And are you particularly stressed at the moment?
No, not really, no.
Got exams or anything?
No, when
What year are you
have
at school?
sometimes...
Year 10.
Okay, so first year GCSE, so the stress is coming next year.
Yeah.
Okay, all right. So let's do some blood tests, and then we'll see what the results of that come back, and then we'll have a chat about it, okay?
Okay, let's go there.
All right, bye-bye.
Thank you.
So I'm going to reach about 110, am I?
Oh, at least. At least.
My mum always said, better the devil you know. You know, I wish I'd have never given up smoking. I'd have been better off.
I don't know about that.
Are you taking any sugar? You're eating no sugar?
I'm eating biscuits and joy. I think that's what it was.
Biscuits have the three things in life we do not need: salt, sugar, and fat. You'd be better off without the biscuits. Mary, don't give up your faith.
Why is it all happening?
I can't answer that.
No, you can't.
I can't answer
There is no answer.
All we can do is try our best. Mary has had an episode of cancer a number of years ago. She had a bowel cancer, which had to be removed. She's one of the most stoic people I think I've ever met. She never complains about herself, and she's always concerned more about other people rather than herself. Whether you are a believer or not, I think people do better when they feel that there is somebody out there that may be helping their lives. I'm not a huge believer myself, but I've seen how people can get support. And I think, you know, places like churches or mosques or synagogues, whatever the faith is, are able to provide a great deal of support, particularly in trying times. And I think that's why she needs to stay with it. Now, spin around a little bit more and pop that hand up here. That's good. Let's pop that out
Now, I
here.
know this is going to hurt.
Right. Now, listen.
And I'm sure you love doing it.
Not quite as saint-like as you thought then.
You are a saint. You are a wonderful gentleman.
OK, Mary, try and hold as still as you can. I'm sorry about that. Well done. Well done.
Do you know what? The liquid going in hurts more than the needle.
Probably. What I might do is see if I can get you back in again in a couple of weeks, maybe, yeah? And then we can see how that's gone, yeah?
Yeah. And talking of my health, why don't you write to your people in Australia and tell them to send a sack full of nice weather over here?
What are people going to do if they can't complain about the weather? It's a national pastime, Mary.
It's now nature, I presume. So thank you so very, very much for seeing me again. I know I'm a nuisance. I won't swear.
Oh, Mary. Let's see how you get on, hey? And I'll see you on the 15th.
Thank you. And you are still St. David. You definitely are.
Okay, Mary.
Thank you.
Bye-bye then. Bye.
Take a seat through in the waiting room.
I'll give a few minutes.
Just through there.
How are you today?
Basically, my ankle and my leg, believe it or not, keeps swelling up so bad I'm in pain in my thigh, the back of my leg and my back. Now, I know I've got type 2 diabetes and they keep checking my ankles and feet to make sure the blood's flowing through. It's constantly swelling up.
But this swelling, is it something new or recent?
No, I've had it for years.
What was the trigger why you came today?
It's getting to the pain now that I can hardly walk on it.
Okay. What about the left leg? Is
Left
okay?
leg's fine.
So let's do a little check now today. Quick check on your legs. Any pain when I press there?
No.
That hurts?
Yeah.
And when I move the...
I can only go up and down.
Up and down, yeah.
That's fine.
Any pain there?
Not at the moment.
Okay.
Do you want me to put these back on now?
Yes.
I wasn't expecting to come straight round here, to be honest with you.
Okay. So clearly, a certain amount of retention of the fluid is allowed, especially if you had a previous surgery or fusion surgery and everything. Do you smoke?
I do smoke, yeah.
How much do you smoke?
All depends, to be quite honest with you. Sometimes, if I'm bored, I would say roughly between 20 and 30 in a night.
So you do know that the smoking is injurious to health?
Yes, after all these years, I think so, yeah.
How many years have you smoked?
I've been smoking since I was about 11.
Okay. Smoking is injurious to health. It can cause cancer, lung cancer and issues like that. Yeah.
I'm not being disrespectful to anybody. I've had a good life. I've got 2 beautiful daughters, 2 beautiful granddaughters and a great grandson. If I died tomorrow, I ain't got no complaints.
Okay. So help is available once you're ready to quit. But you have mentioned what you've mentioned now. So we'll have to just leave it there, but also please be sort of aware that there's an offer there.
Yeah, I understand, yeah.
As a first thing, I would recommend or advise that we get an X-ray done and look at options of whether you need to be further seen by the orthopedic doctors. So you can walk in between 8 o'clock in the morning to 8 o'clock in the evening to Wexham Park Hospital on any of the weekdays.
Oh, great stuff. That's even better.
It's a walk-in service, yeah.
So I can actually just walk in there?
Just walk in and say, my doctor has ordered the X-ray online in his GP clinical system.
Dr. Lee, yeah?
Dr. Nanda, myself. Okay?
Cheers.
All right,
Thank you very much indeed.
All the best.
Yep. And you, my friend. Take it easy.
Bye-bye.
Cheers.
Bye.
Ta-ra.
Hiya.
Hi ladies, all right?
Good, thank you. How are you?
Yeah, don't all get up, like, you know, just sit there, you know.
We've got work to do.
Tea, like, you know.
We've got work to do.
Alana Burnett Thomas. Hello, come on through. You're all right.
Yeah,
Is it that pesky nose of yours, is it again?
I know. She has them 4 or 5 times a day. Last night she had one for about 40 minutes. The school
Oh.
phoned me today.
Yeah.
So it started at 9 and...
It ended after assembly.
Did it?
So,
How long's
yeah.
assembly?
20 minutes.
Oh my goodness, that did go on a bit, didn't it?
So I was just lining up from Breakfast Club and I was just about to go and then it was just dripping.
And is
when I was
it
walking
that
up to
right
the
nostril
playground.
or is that
This
side?
one, yeah.
And what do you do when it starts? Do you pinch your nose? Brilliant,
Yeah.
good girl.
I think the teacher helped because it went on from 9 till 11.
Yeah.
Through the assembly, I think the teacher pinched onto it for about 15 minutes.
For like
yeah.
Any signs of tiredness or anything like that? Are you concerned in any way?
I don't think so, no.
And is it a lot that she's losing? Can I have a little peek up your nose? Is that all right? Okay, Poppy, so I'm just going to literally put that at the edge of your nose. It's going to go in a little bit. Is that okay? Good girl. Yes, you can see it's at the bottom of the nostril, right at the back.
Right.
Where it is. You've obviously got a weak vessel there.
Okay. That's what my teacher keeps on saying. She says that I've got a weak vessel.
Is she
and they
worse when
keep
she
on
gets hot?
bursting. She says, sit in the shade and stop running around.
Yeah, because if you get a bit hot
Yeah, of
dilated,
course,
that
yeah.
can do it.
Yeah.
But it's still got to be looked into,
Yeah,
really,
okay.
for her.
No problem.
Does she ever vomit as well? Because it trickles into the back of the throat.
Yeah. This is what's really upsetting her.
If you are sick, shall I tell you why it's happening? When the blood trickles down into your tummy, your tummy doesn't like it being in there. So because it doesn't like the blood, it makes you sick to get rid of it. So literally every day it happens.
Yeah. Not just once either. How many do you have at school? You have a couple at school and then a couple at home, don't you?
Yeah.
It's 4 times. And it is every
But
single
like
day.
this whole week I've had no
Since September. By Wednesday, phone in and just see if there's an update at all with the referral, and we can see what's going on. Does that sound
I
okay
appreciate
with
that.
you?
Yeah, that's lovely.
Brilliant.
Okay then.
All
Thank
right,
you very
take
much.
care. I'm sorry you're going through this. Look after yourself. Bye-bye.
How do people get through life without being able to read or write? Like how do they pass their driving test?
She probably doesn't drive.
How can I help, David?
An incident happened and I got an injury on my eye. I woke up this morning and it was really hurting and watering.
Okay, and what happened? You got a punch to the face?
Yeah.
Okay.
And it was swollen and you can see there's a cut underneath where they've glued it.
Okay, I've looked at the letter. It says the CT scan didn't show a fracture or anything, you know, of the orbital, so that's the bones around the eye. And they said that the scan in the brain didn't show a bleed or anything, so they obviously discharged you. And did you lose any consciousness when it happened?
For a couple of minutes, yes.
Since Saturday, have you had any vomiting?
No.
Any double vision?
It's a bit blurry, that's about it.
Just switch this light on. Look down for me. Is that hurting?
Yeah.
Okay, I'm just going to have a look. So this pupil's contracting quicker than this one. It's still narrowing, but not as much as the other eye. So I think looking at the eye and the health of the eye and your symptoms, I don't think there's anything too nasty going on, but in case there's a scratch on the surface of the eye and the fact that your eye's now watering and the pain's getting slightly worse does concern me. You need to get the eye looked at properly. And when you tell them what's going on, they should hopefully see you straight away.
What I need to do today is just examine the knees.
Yeah.
Does that cause you pain when I'm bending it?
Discomfort, that's not pain.
That's fine. Put my things back on. Okay. So it's difficult to say what's causing your pain at the moment. When I'm moving your knee, it's got a good range of movement, actually. So I think, you know, a first point of call would be an X-ray. That we can arrange that. Usually takes about a week for us to get the report.
That's fine.
Yeah. In the meantime, how do you feel about some physiotherapy, maybe?
As long as it stops it hurting, I don't know.
Now, if any symptoms, if you ever get it sort of locking in a straight position like that and it gets stuck, or the giving way gets worse, obviously come back and see us.
There was one other thing I wanted to talk. I've been getting angry very quick recently. My wife's noticed it a lot. I did have depression a while back. I just don't want it coming back, if you know what I mean. And this seems to be a thing that happens.
Okay.
I just needed to not talk to someone, but mention it, because I don't like the way it's going, to be fair.
I can see you look quite anxious.
Yeah.
And how long has this been sort of affecting you for more recently?
A few months. It hasn't helped. I lost my dad last month.
I'm sorry to hear that.
But I haven't been sleeping very well either. So I don't know. But it's been going on for a couple of months. And then with Dad, it's just
Okay,
come
it's
up.
kind of made things a bit worse.
Yeah.
Presumably. Yeah. Okay. And who else is at home with you? Is it just yourself and
me
your
and my
wife? Was your father's passing? Was it expected or was it?
No, unexpected.
No.
But that isn't what's caused this.
No.
You know,
things were going on.
It's been going on for a while.
Yeah. And have you identified any things that could have made things worse over the last few months?
What I can think of is just me.
How are things at work?
Yeah, okay, good.
And things between yourself and your wife otherwise?
Yeah, fine.
Yeah.
Yeah, we're good.
Yeah. Okay.
I just don't know what it is.
Do you feel low in yourself?
Sometimes.
Yeah. Do you ever get any harmful thoughts?
I have, but not to the point where, you know, I've sort of, don't be so stupid to myself kind of thing. You know, it's
So
the thought. It's a thought, then it's dismissed. Yeah.
So no specific plans to happen?
Oh no.
Okay.
Definitely not.
Had you had a thought as to what you might want to do to try and start improving things?
I don't know. My freedom was going out on my bike.
Okay.
I can't do it.
No, because of your pain.
I'm not allowed to do it.
Yeah. So, I mean, there's a few options, and I think it largely depends on how you want to kind of approach things now. You were on medications before, and that's one of the ways in which we try and help people who are suffering with symptoms of depression, but that really just kind of, it's not a cure as such. It can try and control the symptoms, but really to get to the root of things, we often recommend counselling as one option. It's called talking therapies in this area, but essentially it's a form of counselling.
Yeah.
Have you ever had something like that before?
I haven't, and to be fair, I don't feel comfortable doing that.
Yeah. Okay.
I don't talk.
Yeah. I mean, what we can do is start you on a tablet again for your mood.
Okay.
Okay. Something called sertraline.
All right.
Very similar to citalopram. Typically, things can get a bit worse for the first sort of week or so being on the medication, but then, generally speaking, after the first month, you should hopefully, if you're going to see improvements, you start seeing them.
Okay.
How does that sound? Would you want to consider that?
I'll try it and see what happens.
And then maybe we can see you again in a couple of weeks' time, see how things are getting on.
Okay.
Yeah? All right.
Thank you very much, sir.
Okay.
Cheers.
No problem. Take care.
I have the 16th.
I was wondering if I can see someone to get wax taken out of my ear because I'm having problems
Are you
hearing.
patient in surgery?
Sorry?
Are you patient in the surgery?
Well, I'm from Australia. No.
From Australia. What you can do, you can go to the walk-in centre. That's the address it is. It's in the high street. Because they'll probably tell you to put drops in your ears, just loosen the wax anyway.
Surely someone can do that because I'm flying on the plane.
I know, but you can't get it done here because first of all you're not registered.
It takes 10 minutes.
I know. That's the only people who can help you if you want the number.
This
okay?
is stupid.
But it's not stupid because you're not registered here.
Well, it's like the World Cup final, isn't it? What happened there? You know, we finally managed to come back a little bit, and then they just knew how to put the foot on the accelerator. So you're not doing well, mate, according to this essay that I can see in here.
I just don't know where I'm going. I'm so...
Why? What's happened?
Oh, I've got loads
differently.
of things. I've got loads of things going on in my life at the moment. 3 weeks ago, he actually attacked me. That's my wrist up, yeah? Okay? I got arrested for assault. I'm out on bail for ABH. Yeah? I've got 2 witnesses who said he's attacked me, but I haven't even questioned them. I mean, all this is just... And then I get home on Sunday, got a letter from a copper, we need to speak to you. So I phoned them up, they said, oh, your dog's been reported for attacking people and children. We need to sort it out. And I started losing because I just started losing it big time, yeah, and I just left the phone on and walked away, yeah, because I just couldn't answer it, yeah, I just could not answer the question.
I've known David for many, many years. He has a number of problems that were going on, one of which was a fall whilst having an altercation, which led to an injury, and he ended up having to go and have an X-ray. So 2 problems. Firstly, the wrist and his pain, but secondly, the altercation and what came after that, which is affecting him quite badly.
Yeah, it's just constantly, yeah. And I mean, Sunday, yeah, I just lost it big time. And I literally got home and I had my drugs out and everything. And I was quite happy just to end it all because it's just, at the moment, no one seems to be giving a... Well, sorry about the language, but that's how I am really...
Mate, I can understand how you feel because, not many people have that many things going on at the same time, do they? Do you know what I mean? You've had this and this and this and this and this, and they're all getting on top of you to the point where you're at breaking point. Two things. Okay. Firstly, I want to get you back next week and see how you're getting on. Okay.
Yeah.
I don't have a miracle for you. I can't change all of those things for you.
No, I know.
Do you know what I mean? But I can listen to you and I can agree with you, and we can talk about ways forward that you might be able to take to try and help this out.
This wrist, hang on. There was a letter sent to you, but I know you don't. Well, you don't read it, one of the two. About this wrist, yeah. One consultant is saying it's broken. The other one say it's not. I'm in absolute agony with it, yeah? I'm in absolute agony with it, especially around this area.
Okay, we need to x-ray that again. Because your pain is down in here, in that area there.
Yeah, it's all...
Okay, so if I press in there, so this is what we call your...
right,
so it doesn't matter
right
what it's
around
called.
here, this area is really...
But you've got a little bone under here that if you break that bone, then you can run into real trouble, okay?
I mean...
The difficulty is that it doesn't always show up straight away on x-ray.
I mean, the bruising's gone down a hell of a lot, yeah? And it wasn't any...
So you are sore in there, aren't you?
Yeah.
Okay, so we re-x-ray.
Any swelling as such.
What I want to do, okay, so there's two bits to this, okay? I've organised an x-ray for that, okay? You need to go tomorrow to Wexham, okay?
Yeah.
Between 8 a.m. and 8 p.m.
Yeah. No.
Okay, they will do special views to try and look at that bone, okay? We're going to continue this conversation next week.
Yeah.
Okay,
well,
mate.
This is the problem.
This...
I know you only got a short time to see me, yeah? And, I mean... Sorry, yeah, I know. But, yeah, I mean, I know...
Look, I understand, mate, and I understand your frustration, and I understand how you're feeling, and I understand exactly what it is. This is to try and help you sleep a little bit at night.
All right.
Okay, 2 in the evening. They're not addictive or anything like that. Their side effect is it makes you sleepy. It's no guarantee, but it might help a little bit, and next week you can tell me how you're getting on with them.
All right.
Okay, mate. Look, we'll have a chat next week, okay? Yeah.
But I have no family I can actually go and speak to. I might go on a Jeremy Kyle show and be an idiot, yeah, like all the rest. They always seem to be on benefits and... Yeah, we walk on stage and it's supposed to be on disability benefit. Yeah.
Well, if you go on Jeremy Kyle, you'll end up punching somebody, won't you?
Yeah, but
that'll be all over, and then you'll be back in front of the police station.
Yeah, so I just... Thanks all day.
Cheers, mate.
Farnborough Surgery, you've been to Pam, how can I help? Oh, hello.
How can I help you?
I was diagnosed with anorexia nervosa, and so I was in and out of food disorder clinics and things like that, and so they said to go for a bone scan just to check on things, and it was found that my bone density was quite low. I was told that I had early onset osteoporosis then. I was told that a follow-up scan would need to be done 2 years later, so that would have been 2012, and I've still not had it done yet.
All right.
And I was kind of worrying because, like, when I get up, mostly in the mornings, like, I really ache. It takes me a while to be able to get out of bed, and I'm just worried about, like, as I get older with osteoporosis now, that it's going to affect me more.
How old were you in that time?
14, 15.
14. And now, since then, are you eating all right?
Better, yeah.
All
Much
right.
better.
You look happy.
Yeah.
All right. Okay.
A lot healthier than I was.
And how is your weight doing?
Good, I think.
You put on weight?
Yeah.
Okay. And how about your periods?
Good.
Yeah.
Fine, absolutely
Passing, urine, bowels.
Yeah.
And you mentioned this joint pains, or is it just one pain?
Just general aches and pains. More so when I'm active, like if I'm doing a lot of walking, and I play football quite a bit. So more so then I ache a lot after, whereas like normally someone might ache a bit after the gym, like I ache thoroughly after the gym.
Are you on any medication on a regular basis?
Not now, no.
Like steroids or anything like that?
No, nothing like that. Never have
All right. Okay. And what do you do? Do you work or are you studying at the moment?
I'm an SEN teaching assistant at the moment.
All right. How is that going on?
Great.
Okay. All right. So basically, you want to make sure that you have a scan and that you don't have osteoporosis or is it not progressed?
It's not progressed and got worse.
All right. Okay. Now have a quick look at the notes if that's okay with you. Were you given some vitamin D tablets and things as well at the time?
Yeah, I was given Adcal D3.
So your BMI is okay at the moment, but I think it should be okay to organize a scan. The reason why I was doing it because there are certain criteria you need to meet for a scan, and sometimes they reject it. All right, so that's done.
Okay, thank you.
Okay. Obviously, if you don't hear from them in 2 to 3 weeks' time, just ring the secretaries to find out if the form has been anywhere declined or anything. Yeah? Okay?
Thank you.
All right. Yeah.
Daniel Zaloga, please. Okay, how are things?
Yeah, I come down with it. I've got a small problem. Actually, it's a habit. I do smoke ganja for a couple of years now, and it came to that stage. It started ruining my life, relationship, and stuff like that. I end up in police station.
I called the police.
Yeah, my mom rang police because
I called police because
I lost the control of my brain and body.
What happened?
in the morning on Friday he called to me and he told me I killed myself, blah blah blah. You see one person, inside is two guys. One is good, one is bad. Sometimes he don't have a control of himself.
It's not that I don't control, I just got short
Daniel
temper.
don't have a control because he is a little bit angry.
How do you feel about this? I mean, would you say that's true?
Yeah, that's sort of true. When I've got a short temper, I'm not gonna say I've got short temper.
Okay.
He needs help, you know.
Yeah, I need some sort of medication to come off from marijuana.
Daniel was a 23-year-old guy that I saw with his mum. I've seen quite a few patients now in their early 20s who come with parents or girlfriends. I think it's quite common now, and actually for me as a GP, it gives me quite a nice insight to speak to a relative as well. It gives me an idea of how cannabis use is actually affecting other people in their lives.
How long have you been smoking marijuana for?
Oh my gosh, my friend, I've been smoking for
Around 8 years.
8 years now.
He smoked around 15 joints a day.
15, so over 3.5 grams in a day. I'm even reaching 5 grams in a day.
Okay. And apart from marijuana, any other drugs that you take? Or any tablets or any injecting? No? Okay. Do you drink alcohol?
Once in a blue moon.
Once in a blue
Like
okay.
everyone.
Okay. Do you ever, just a few other questions about your mental health. Do you ever see or hear things that aren't there? Anything like that? Nothing like that?
Okay. Get to that level.
At the moment, maybe no. At the moment.
Yeah.
He have it after, so you know, like he's...
You mentioned...
No, listen, don't think I'm that crazy, yeah?
You know,
I'm not into that stage anymore. I'm not in that, I've never been in that stage. Yeah? Don't make me a psycho because I know where I am. It's just a bad habit. So don't chat shit, yeah? You understand? Don't talk shit because I don't like it.
Let's bring this back to your symptoms, okay?
Yeah.
So, apart from the anger, you've mentioned on one occasion you rang your mum, you said you felt like ending your life. Do you remember having that conversation?
I kill myself, I said I'm gonna kill someone else. That's the reason I end up in police station and...
Okay. Do you feel like that a lot? Do you feel like you have a lot of anger? Do you feel that you're likely to harm other people?
Yeah. Yeah, I quickly get angry. I lose my temper quickly.
Okay. So here's the thing. We know that smoking marijuana as regularly as you are doing definitely has mental health side effects. Yeah. Okay.
So I think there's a lot of evidence now gathering about the link between cannabis use, and in particular skunk, and mental health problems. In this consultation, I spoke to Daniel quite a bit about some of the other side effects that maybe he'd been experiencing, things like seeing or hearing things that aren't there, but also other mental health problems like low mood and depression often coexist with cannabis use, but often the first point of call is to try and address the drug habit before you then go on to try and deal with the mental health problems.
So, you've done the right thing by coming here today, okay? I think that's a positive step.
Yeah.
So, first instance, I think we need to get you some help with one of the drug workers who works in the drug clinic in Slough.
I would really appreciate that.
So if you feel that some of the side effects, so your anger, or you feel that you're feeling like harming yourself, or anything like that, you must come back and see us, okay? Because sometimes we also need to refer people sometimes to psychiatrists who deal with mental health and drug abuse, okay? But I think the place to start is to try and get you to reduce your amount of smoking and eventually stop it, okay? All right.
See you.
All right, take care. All right, bye-bye.
Mr. Chiappetta, come in. Thanks for waiting.
Thank you very much. Just see me.
That's okay. Take a seat over here, please. That's it. My name's Sheila.
Hi, Sheila.
Hi there. How can I help you?
I just cut my finger on the.
What were you doing?
I was trimming a door with a circular saw my hands.
Okay, was it a circular saw? Okay, I'll take that off and we'll have a look.
That one is not bad, but this one, they look quite deep.
Okay.
I put out for all.
Yeah, I can see. Are you diabetic?
Yes, I am.
Okay. Oh, you're good at DIY, are you?
Yeah, cut my finger. You can see how good I am.
That's it. Right, let's have a look here. So what state are the doors in at home now?
Oh, it's all right. I've been kicking the door.
Okay.
And I didn't destroy the saw either.
You didn't destroy the saw. Those circular saws
They're dangerous.
can be lethal, can't
Yeah.
they? Oh, this is really wrapped round, isn't it?
I could stop bleeding, so
Where's the end of it?
I think it's on the bottom.
I've got it here, yeah. Oh, my goodness.
You make a good mess.
I think that might need stitching, you know. Hold that on there for me, please. It's quite deep. You being diabetic, you've got to be really, really careful, as you know, with your, you know, your extremities, your fingers.
Yeah.
Can you feel this?
Yeah.
Can you feel this?
Yeah, it's a bit dull, but I still feel
A bit dull, yeah.
Yeah.
So we just need to make sure that there's been no damage inside the finger.
Oh, yeah.
Okay, I'm going to put a dry dressing on here for you.
Okay.
This one, I'll dress it, but you do need to go up to the A&E and probably you might even need an X-ray on it because that's gone in quite deep.
Okay.
Okay? Okay, right, if you hold that there and I'll just get some bits and pieces. Will you take yourself up there now or not?
Yeah, well, I have to go pick my wife up anyway.
Yes.
She works in the hospital.
What does she do there?
She works in catering, in the kitchen.
Oh, yeah, yeah. That's it. Oh, my goodness me. It'll get you out the washing up anyway. OK, let's just... I'll just quickly write you a letter.
All right,
and then
I'll
bring
just
it
go
up
straight
here.
up there, yeah.
Yeah, and then go up to A&E, OK? OK, then, I'll just be a few minutes. All right? No worries.
Thank you, sir.
You take care.
All right. Bye-bye. Bye. Thank you very much, Dr. Joangie, as usual.
Thank you very much for your help. You're welcome. Nice to see you. Bye. Bye-bye. Thank you for coming in. Gordon Runham. Right, just take a seat. Right, so how can I help?
I don't know how to say it, like, you know when you get dizzy, yeah? But not dizzy, like lightheaded.
Like unsteady? As if you might fall down?
Yeah, like lightheaded, like it's not, not getting enough blood or oxygen to my brain, you know what I mean?
Okay, and is your vision straight?
It just feels like a bit distant, you know, like, like it feels like I'm going to pass out.
Really?
But when I breathe in, it's not. That's when I get it. Like everything becomes a bit tight on the left-hand side of my body.
Oh, right, okay. But it's mainly when you breathe in. Okay. Just have a listen to your heart. Deep breath. And out. And out. Good. Just take a seat there. Relax while you're having your blood pressure done. I'll explain it to you. That's good. So, what happens when people, particularly young patients who are fairly fit, breathe in, the heart rate slows down. And when they breathe out, the heart rate speeds up. And it's called sinus arrhythmia. The amount of blood that each heartbeat pumps out is bigger. Your heart beats less often. Your blood pressure also might fall slightly, and it might give rise to this slightly lightheaded feeling. So your heart rate slows from about 72 when you're resting, and when you breathe in, it slows to 60. And then when you breathe out, it comes back to 72.
Right.
Roughly. But it isn't abnormal. If you don't understand what it is and you become anxious about it, that
Makes it worse.
effect can be magnified. That's right. That's all it is.
So what's the dizzy? Why do I feel like...
It's because when your heartbeat changes, there's that lag period where it catches up in terms of glucose and oxygen in your blood to your brain.
What about the breathing as well? Is that just a bit me being anxious?
Correct. That's what it is.
Yeah, of
so in this situation, it's a normal phenomenon. Our job is to distinguish between something that is important and something that doesn't need any medical intervention and isn't indication of disease.
Yeah. Is that it sorted?
That's it.
Cheers, Doc. Thank you very much.
Yeah, nice to see you, yeah. You take care. Bye.
Hold it. Hello, how are you?
I'm feeling good.
You're feeling good?
Yeah.
Why are you here?
You sleep there.
No, I don't tend to sleep there.
Yeah, it's a bit of a cough. It's been on and off for a few days. And it's just it's starting to get a bit deeper, a bit more pronounced.
Has he had a fever, do you think?
No, not really. Just a cough.
And what about eating? Is he eating okay?
Not really. It's just less and less.
Has he had chest infections or anything like that before?
Yes, yeah, when he was a lot younger, perhaps 2 or 3.
Do your ears hurt you? Are your ears okay?
Yes, my ears okay.
Okay.
And my nose and everything.
Everything's okay?
Yeah.
All right, fantastic. Can I just take your temperature? It ticks like a clock, all right? That's fine. I didn't hear it ticking though, did you? It's all right though. I haven't got a fever.
What's that?
Just takes your temperature.
Is it my brain? That's my heart.
Your heart's on the other side there, look.
Yeah.
Yeah. Can I just put this on your finger? It doesn't hurt.
Tickles.
It tickles. I'm checking oxygen levels in your body. That looks fine. Thank you. Can I look in your ears? You look very smart today.
That's so tickles.
Can I look in the other one? That's it. Pop your tongue out. That's lovely. Well done.
Do you check my heart?
I'm going to check your heart if that's okay. Oh, it's a bit of a tickle.
Do you hear that?
I can hear your heart, it's fine.
No.
Again. Yeah, he's got a chest infection. I'm going to tuck your label in, all right? So you need some antibiotics. Okay.
I got a chest infection.
You have got a chest
One
infection.
Hello. Sit down, please, lad.
Okay.
Take that.
Thank you, Dad.
So it's going to be 4 times a day, okay?
So do you reckon it'll be a bit advisable just to keep him in today?
Yeah, I'd keep him at home.
Sure.
Have a nice rest today, yeah?
Yeah.
You've got a cough, haven't you?
Bye,
It's lovely to see you, and I hope you feel better soon.
Bye.
Okay, good boy. You've been fantastic.
Thank you
All
very
right,
much.
thank you.
Sorry, just go down. Quick, pharmacy down
Pharmacy's
here.
just down there, yeah.
Thank you.
Bye.
Samantha Holmes. How are you?
I can't take this anxiety anymore.
Go on.
Just this constant feeling of doom and just... My chest feels really tight. And those pills, I was hoping that they would help, but...
What's made things so bad?
There's nothing that's triggered it, it's just... I don't know. It's horrible because I'm constantly feeling like jittery and when you asked before if I had suicidal thoughts and stuff, I said no because I didn't want anyone to think that I'm some nutcase, you know.
Mm.
But I used to self-harm and stuff. Yeah.
Have you done anything recently?
No, I haven't done anything in a while.
So what sort of thoughts are you getting?
Just... I just feel like if I wasn't here alive, things would just go on smoothly and there would be no problems.
Richard Baker. Come and take a seat. So, how are you?
I feel a lot better than what I did.
I'm not surprised. Your sugar's very much better.
Oh, good.
So, when I saw you February time, it was up at 113.
Yeah.
Up here.
Yeah.
It's now come back down to 84.
Oh, so it's...
So those tablets are working?
Yeah, good. Yeah, I lost a little bit of weight when I first went on them.
That's right.
But it's evened out a bit
Oh,
since.
right, okay. So no problems with the waterworks with them?
I've still got the problem of getting up too much at night, but nothing otherwise, I think. Yeah.
Good. Shall we do your weight? Well, just to see what it's doing, don't worry. So take a kilo off for your shoes, so we say 113. Wow, you've lost 5 kilos, so that's about 11 pounds. That's really good.
That's more, yeah. What I
That's very good.
from scales, yeah.
And you'll be feeling better as well because you've lost the weight.
Yeah.
Okay. I think it will continue to come down, you know. I really do. You do look very much better. Losing a bit of weight at your age, it helps with your joints, helps with your mobility. It just generally makes you feel much better. So,
Yeah. So the only concern I got is getting up so much at night.
how many times are you going in the night?
I get up about an hour and a half after the first time I go to sleep.
And then how many
And
times?
then it gradually extends 2 hours, 2.5 hours.
The prostate warning signs are mainly to do with how you pass urine. Men will notice going to the toilet more often than they normally do. When they go, they're not passing as much as they normally do. Or the stream isn't as strong. They'll also find that they are getting up several times in the night to pass urine.
Would you mind if I examined your prostate today?
No, that's right.
The problem with prostate symptoms in men is that it's quite embarrassing in their eyes to come in for the intimate examination. They don't like to admit that they have a problem. And if we catch prostate cancer early, we can cure it. So I would like to say to all men out there, if you're having symptoms, please come to us.
All right, take a deep breath. That feels smooth, so that's good. Let me just wipe the gel off.
It's a few seconds of embarrassment and then it's over and done with, and we could change your life.
We're all done now. Just get up carefully, don't topple off. Okay, let me just sort yourself out. So I'll put the request on the computer for you to have the prostate blood test done, but book that in for a week, 10 days' time.
Yeah.
Is that okay?
Yeah.
As regards your diabetes, we'll see you again in 6 months.
6 months?
Yeah? I'm ever so pleased.
Yeah.
Really, really good. And you look really well, which is great.
Yeah.
Obviously, being up north is good for you as well. Yeah.
Right,
Take
thanks
care
for
of
all
yourself.
that.
Bye-bye.
Come through. That's okay.
So you're...
I'm going to sit there, yeah? Righto.
Okay.
Yeah, I was referred to by Dr. Butt from Weeks Drive surgery.
Okay. Fine.
So it's to do with that.
Okay.
I used to suffer from acne, and I've always had like a little thing there. And I was shaving one day, and I must have got some dirt in it, and I've never bothered about it.
Yeah.
I just wondered if you could
Yeah,
possibly get rid of them.
I'll see.
Or give
what
me
I can
something.
do. Yeah, okay. So do you mind if I feel around the area? Just see. Does it cause you any pain at all?
No, no.
Have you tried squeezing it?
No, I didn't want to.
It looks like there's a keratin plug in there.
Yeah.
And from looking at it on the surface, it looks like something called a comedo or comedone, basically, is where you can open it. And it's sort of like an open pore. So what I'm going to do to make it more comfortable for you is get you to lie on this couch.
Oh, right.
Yeah.
You can have a go at it, are you?
I'm purposely not going to cause you pain. And if I do, then you must tell me to stop.
No.
All right? Okay, so lie on your back.
Yeah, okay.
And this is more for me to get an idea of.
Yeah.
But occasionally this is...
Yeah.
It can be quite useful to get an idea of what the consistency. So in that area, there is sort of a firmness.
I'll tell you if you hurt me, but you carry on.
Can you see that's sort of the area where there's sort of this sort of plug inside the middle? You can sort of squeeze and take these things out, but is that causing you pain?
No, I had an itch. It's all right, carry on.
I had an itch.
Yeah, go on, carry on.
So I'm just trying to see. So this can be, there are different ways, but just trying to see. So you can see there's sort of one of them. Now this is something you can quite safely do at home. Is that causing you pain?
A little bit, but if you can get it out, I'd rather go through the pain and...
Because this might be difficult. So over time...
It's probably better that you're doing it rather than me.
So you can see this sort of keratin consistency coming out.
Okay, yeah.
So you feeling okay?
Yeah, I'm all right.
I haven't done very much. It was more just to see what consistency was in, and you can see that.
Yeah.
But if you kept doing that over time, it will tease itself out.
It'll come out with it. Okay.
There are some things that I can give you that can sometimes help break down that area.
Yeah.
What I've given you there is a dapaline cream, which
Yeah.
is to be put on at night time.
Okay, fine.
If you find they're becoming very painful and nothing's
No,
progressing, then
it's
come
all
back
right.
to
Hurts
us.
a bit now because you've been squeezing it.
Yeah,
That's all right.
I'm really sorry.
Don't worry about it.
Bye-bye. Thanks for talking to Patrick as
That's
well.
all right.
Thank you.
Okay, thank
Bye.
you, Chris. Anyway, have a nice day.
Bye.
Morning.
Tierney O'Shea, please. Hi there.
Hi.
All right, sorry for the wait. I'm Dr. Taylor.
Hello.
How can I help?
Well, it's coming up to 7 weeks now that Tioni hasn't had a voice. She had a terrible cold, very, very sore throat.
Yeah.
She was given antibiotics because it was on the verge of tonsillitis.
Okay.
Swollen tonsils. And then it went into laryngitis just after
Okay.
that. I brought her back. I was
Yeah.
told it would clear.
Mm-hmm.
Still nothing seems to be curing it, really.
Is it still sore? Okay.
The only benefit she says that she has is when she's in lessons, she doesn't have to answer questions.
Shall we have a look? So you're not having any fevers at the moment, otherwise you feel quite well in yourself? Yeah. Just going to have a look at the back of your throat. You know the drill.
Not nice, I know, darling. Bless you.
Can I have a look in your ears as well? Okay. And the other one? Press that into your neck. Is that sore? No. Okay. Let's just have a quick listen to your back of your chest as well. Do you want to just turn around? Okay. So, your throat doesn't look too bad. Your tonsils aren't up. There's a little bit of redness at the back there. But otherwise it looks okay. And your chest sounds fine as well. So I think you're right. I mean, this classically sounds like laryngitis. Obviously, it's quite prolonged.
Yeah.
To be honest, at the moment, apart from it being laryngitis, I can't really
think of anything else that I think would be more worrying that we need to be ruling out here. And in the absence of any pain there or any obvious swelling of the tonsils, it doesn't look like there's any active infection
Right, okay.
there. And I think what we're seeing is the aftermath of the infection that was there just over a month ago. The only other thing that potentially we could do is get an ENT doctor, so an ear, nose and throat specialist, to put a camera down the throat and make sure that there's nothing else going on down there. But that would seem a bit mean for something that I'm pretty sure is still just the after effects of a virus.
I understand that. But obviously this is going on for so long and I want it looked into further to see it, you know.
Do we have your correct contact details?
Yeah. Okay.
All right.
That's great, Doctor. Thank
No
you
problem.
so much.
Take care.
Bye-bye.
Bye.
Don't feel so hard on yourself. You've done a great thing by looking after your mum. You are doing a great thing. And what about in terms of supporting you and with everything you have to do?
There's nothing I can say or pinpoint that says, okay, that's what's causing my anxiety or, you know.
It's just everything.
Yeah.
Yeah? Okay. So you're going through a bit of a tough time. But it will get better. If you want it to. You want it to get better?
Well, of course I do.
Okay.
But
so you don't think talking to anyone will help? So I take it you didn't call talking therapies? Okay. So what we're going to do about your medication?
I don't know.
Sometimes there's another medication that we can use, which doesn't really help with what's going on up here in your brain, in your head, but can help with the physical effects, so that actually just calms things down a little bit so you don't feel so heightened anymore. And we can actually give it in conjunction with the fluoxetine. Do you want to give that a go?
I'm willing to try anything at this point.
Will you come back and see me in a few weeks? Yeah. Okay, because I haven't seen you in a long time. You've not touched base. I'm going to ask you again. Got any plans to do anything silly?
No.
Okay. Do you need some more fluoxetine?
No, I'm fine with that.
So I'm going to ask you to take 3 every day, and then I've updated your records so the next time that you ask for one, you can have some more, okay? I want to see you back in a couple of weeks. So don't worry. We're going to be all right. You're going to get through this. And you're going to start feeling better soon.
I've heard that so many times.
Okay, let me rephrase that. If you want to get better and you want to start feeling better, then you will. It's just going to take a bit of time. Okay? So keep talking to me.
Okay.
No more going off. All right?
Thank you very much.
Take care. Antidepressants work for some people and don't work for others. Given the right support, given the right psychotherapy and positive enforcement and encouragement, people can recover.
Yesterday I woke up with my ankle was swelled up in it and it's very hurting every time I walk.
But you're not registered with this yet?
No, I've only just moved here.
Do you know where Upton Walking Centre is in Slough?
Would you be able to put me out for a little map?
So, how are you feeling? How are you keeping with regards to your chest?
Yeah, not too bad. It's still alive. I do have a cough, and I do cough loads out, especially if I'm waiting to go to bed and I take my inhalers. Oh, mate, does that clear your chest out?
It's just part of the disease process, COPD. It's just because of damage to the cells in the airways, they do produce more mucus. Keep drinking plenty of water, because if you get dehydrated, it can be quite difficult to bring up because the phlegm dries out.
This don't trust me.
Yeah.
I drink about between 5 and 8 cups of tea, in big mugs, every day, guaranteed.
Good. So how many are you smoking now, Michael?
I've had 3 or 4 so far today, roll-ups. I do smoke a bit of puff, still.
What do you mean by a bit of puff?
Bit of marijuana.
Oh, right.
I've had it so long, I could just put up with it.
Mm.
But at night, I do like a puff before I go to bed. Then I could go into sleep.
That helps you sleep.
Yeah, it's the only thing, yeah.
So relax, blow first. So big breath in, tube in mouth, pinch your nose and blow out nice and slow and
I
steady.
can't breathe out my nose anyway.
Oh, right, okay. That's it, keep going, keep going, keep going, keep going, keep going, keep going as much as you can. Good. Right, try and get it right in your mouth. You seem to be pursing it a bit sitting it on the end of your...
I thought I was kissing it.
Yeah.
I know. I'm too much of a gentleman.
Right, go on then. That's good. Keep going, 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 keep going.
Nothing left. They're empty. No more.
No, that's fine. No.
You made my day, thanks.
Okay. So,
Did I pass my MOT?
well, it is a bit worse, I think, than last time, Michael. Your ability to blow out the full volume is the same. It's just your ability to blow out forcefully that first second that's gone down. You know, I think the only thing that you can really do is to stop smoking to try and stop this from getting any worse, really.
Yeah. I don't even want to take that vape thing, really.
No.
That's
Have
what I
you
don't
have you done the pulmonary rehab course, Michael?
No? What's
No.
that?
It's a 6-week course at Upton Hospital, and then they'll give you lots of different exercises, techniques to cope with your breathlessness.
How long are you in there for each time?
2 to 4 hours, I think. So the
2 to 4?
yeah, I'm not quite sure, but
Go on then, refer me. Okay
Good.
then, Doc. Thanks, Julie.
all right. So keep
Okay.
yeah.
All right,
I'll
will.
refer you to pulmonary rehab, and yes.
Rehab, I
Keep-
like that. Thanks
All right. Take care, Michael.
Fill me in. How are you?
Well, to be truthful, I couldn't write anything down because
Okay.
It doesn't bother me.
Okay.
The only time,
This is the prolapse we're talking about, yeah?
Yes.
Yeah. Yeah.
The only time it bothers me is when I pass water and wipe myself. I can feel it, but not every time.
Louise is one of my patients who is 91. She's a sprightly 91-year-old who has seen me over many years, really, for a prolapse of the uterus. If this were the uterus, that's the body of the uterus or the womb. This is the mouth of the uterus or the cervix from where the smear is done, for example. Occasionally, when the supports are weak, the uterus can actually descend down into the vagina, sometimes to the external opening of the vagina, and can even be seen outside the vagina in very severe cases of prolapse. So let me just recap. You had a ring pessary for the prolapse, and then every time we had a problem, such as a little bit of bleeding because the ring was causing you a problem there, we took it out. The treatment of a prolapse uterus varies depending on the degree of prolapse. So we would send them for physiotherapy. If physiotherapy doesn't help, there is an option of surgery available, but there are some women who actually don't want to have surgery. In that event, we can actually offer a ring pessary to a patient. A ring pessary essentially is like a little bracelet. It's made up of PVC or plastic, and it sits in the vagina, at the top of the vagina, supporting the uterus.
I mean, is there any harm in not having it in?
Not at all. This is why I said to you last time that let's do this exercise where without the ring pessary, you can actually then decide, is this prolapse really bothering me? And you've just said that it actually is not troubling you that much. Put anything in there.
Does it get any worse?
Very good question. So the prolapse can get worse if you get constipated.
I am trying, because I have piles and that causes me of a...
So are you constipated? Are your stools hard?
No, I'm not.
So
Because
you-
I take lactulose.
Perfect.
Yes, yes.
So make sure that you do not get constipated.
Yes.
Take the lactulose regularly because when your stools are soft, you're not straining
Yes.
to pass stools.
Yes.
And when you're not straining, you're not pushing bits of the vagina further down.
No, I
okay?
understand.
Obviously, don't lift heavy weights, but I don't think you're going to be going around lifting heavy weights. And of course, if you had more children, you might.
I don't think I will now.
You don't think you're going to have any children now,
I'd
so
make
that's
history.
yeah, exactly.
What I was going to ask
Yeah.
you, my sister wants me to go and see her in Canada.
Okay.
And with this,
Yeah.
I'm a bit concerned.
With the prolapse?
Yeah, would it be all right?
Yeah, perfectly. It's not going to bother you on the flight because when you sit down, it doesn't bother you.
No, that's right.
It's not really going to get worse so long as you take all your medications, take your lactulose and make sure you're not
Yes.
constipated.
Oh, definitely.
So I can't see that
It's any
being a problem.
Oh, right.
You just
I
need to
wanted
relax and
ask
have
you
a
that.
good holiday.
Thank you.
Yeah, absolutely.
Thank you very
So
much, Doctor.
it's always a pleasure to see you.
Come on in. How are you getting on?
Oh. Life's just it's just dragging, it's boring.
And the weather doesn't help, does it?
I can't do anything, I just feel trapped
Yeah.
in my body, you know what I mean? Really do.
You'd recently had your procedure done with the gynaecologist.
Yeah. From the operation, would I get any infection from that? You know, having utensils as such put inside me. I felt a bit uncomfortable and a little bit sore afterwards, and I still feel a little bit twingy now. A
Yeah.
little bit,
I think if you had an infection, you'd probably know about it. Often you get sort of quite severe pain or a lot of foul discharge.
No.
You know, so if that's not really happening, it's unlikely.
A little bit,
Yeah.
a little
Yeah.
bit sore, a little bit itchy.
Thelma had a hysteroscopy recently, a procedure that a gynecologist would do, where they essentially have a closer look at the inside of the womb and look at the health of the lining of the womb. They use a small camera on the end of a telescope. In Thelma's case, they also did a biopsy, which is where they take a sample of the lining of the womb and send it off to the lab just to make sure there aren't any cancerous changes, for example, in the cells of the womb. And is itch around the vaginal area?
Yes.
Okay. I mean, one thing we could try, because it sounds like this potentially could be thrush, for example.
Yes.
And that's often what causes itching. I could give you something, a cream and also a pessary to put inside.
Cream and pessary is no good.
No?
I can't exert them.
Right, okay. I can give you a
Because
tablet.
I can't bend. Yeah, tablet would be fine.
Yeah?
Yeah.
Okay.
There's nothing I can do to get there at all. Bending is out of the question. Because I've just had last year a toilet, and I think I told you, I had a special toilet in my house for £3,725.
And what's special? And what's
special about
so
it?
is it
You asked me that. Well,
Yeah.
you sit on it, so it washes you, and then as soon as you stop your elbow,
see.
the one. So you
Okay.
stop, it dries you. Little hand
That
comes out.
sounds very high tech.
It's amazing. I love it.
All right. So that's the tablet for the
Lovely. Just stop being comfortable.
yeah. So it's just a one-off tablet. All right. It was nice seeing you again. All right.
Okay. Thank you.
Take care.
God bless.
All right.
Yeah.
You know that clock in the pharmacy?
Yeah.
At Welsh Dragon?
Yeah.
I bought that.
Did you? Oh, it's lovely.
How can I help you today?
I lost my friend about 4 or 5 weeks ago.
Oh.
I haven't been able to sleep since.
Was she a close friend?
My best friend for 35 years. So I can't sleep at night very well. I keep getting bad headaches. My body's all hurting. I've got osteoarthritis anyway, but I think like with the stress, my whole body's hurting. Like some days I can't just walk.
Have you tried some physio for this joints pain? Have you been referred to physio? Looks like it's been going on for many years
No, I've
now.
had this like for about 10 years. There was a stage before they actually found out what was wrong with me. I couldn't walk.
I can
like,
see that
today
you were
is a good
referred to
day.
physiotherapy quite a few years ago, and then
Yeah, it's quite a while ago.
2012. Might be worth doing that again.
Okay.
But with regards to your sleep, it's easy to just give you a sleeping tablet, but that's not going to help the situation.
I'm trying to get over it. It's hard because she was part of my life every day.
Do you think you need some counselling? That's something you could probably try. You can self-refer.
I suppose I could, yeah.
So they do bereavement counselling. Shall I give you the contact details of the talking therapies?
Okay.
Yeah, and then you could probably contact them directly because you don't need a doctor's referral.
Okay.
We need to address the primary issue. So counselling might help if you're still struggling. They do bereavement counselling separately. Yeah. So I'll give you the number. And you can self-refer. All right? Take care. Be strong. You've had many good years with your friend.
Very good.
Yeah, so you have a lot of, good memories to cherish. And everyone have to go, but it's the way how we deal with the loss, isn't it? It's difficult, but they say time is a healer. Okay, be strong. All right. Okay, Jan, you take care.
Thank you so
Yeah,
much.
you're welcome.
Thank you.
Take care. Bye bye.
Thanks a lot. Bye.
Just give me 1 second. Excuse me, ladies. Hello? Any help out here, please? Thank you.
How can I help you?
Doctor, I've been bleeding.
Okay.
I am so desperate. I need something to help me.
When you say you've been bleeding vaginally? Vaginal
Yeah.
bleeding, okay. And are you bleeding very heavily then?
Yeah, because I've had 2 different types of medication prescribed.
Okay.
But I think none of them have actually worked for me.
Okay.
I am so desperate. I am dizzy. I am weak.
Okay.
My problem is because I've been bleeding for, it's almost 2 months now.
Yes.
And, you know, I tend to get sore.
Yes.
So I feel like I'm losing so much blood.
Okay.
So that's where my concern is.
That's your worry, is it?
Yeah.
Okay. Well, we did do some blood tests recently, and they were okay. They showed that you weren't anemic. You weren't losing too much blood. Okay. Let me just check your blood pressure today. Make sure that's okay.
But Doctor, do you know why I'm so tired, so dizzy, and all that?
That might be to do with the bleeding. It might be the hormones. Okay. Do you have much stress?
Yeah, kind of.
Stress is something that can make people feel very tired. Where is the stress coming from, do you think?
I've been on the medication for a long time. I've been on medication for a very long time. But I stopped it myself because I thought, you know, maybe the medication were not working and I needed to, like, just say to myself, maybe I can do it. But I think sometimes at one point I get discouraged, and I've tried to take my life so many times. It's not as bad as it used to be, but sometimes I really get to that point where I feel like going back to that stage, but I try to put myself together.
Well, even if you don't feel as bad as you used to, and you don't necessarily feel like taking your life, you can still feel tired and down. And
Yes,
just because
I
it's not
feel
as bad
down.
as it was doesn't mean to say it's not causing you to feel quite tired and weary a lot of the time. That's probably the cause of you feeling like that. But we can do some more blood tests just to make sure you haven't got other vitamin deficiencies, other diseases that we've not tested you for. Your blood pressure is actually okay, so you're not losing too much blood to make you faint and dizzy.
Is there nothing else? I am tired of, I'm so sorry to say this, but I'm tired of wearing pads.
So let's go back to the medications that you were prescribed then. How long did you try the tablets?
The first one, they asked me to take it for 7 days, but I took it for more than 7
Yes.
days because I had to take it because it was still, you know, but at
it
one
work?
point, it was working. At one point, I thought it was going to stop.
Yes.
And then it started again, and then I took the rest of it.
Yes.
So I thought when I finish it, it's going to stop. Then it stopped, and then started again.
Okay. So we could put you back on that one. Would you like to do that?
But this second one hasn't worked at all.
All right. Let's go back then to the one that did work. Okay, so just start taking that every day.
All right. I'm so grateful, Doctor.
That's
Thank
all
you.
right. Okay, and keep taking them then until after your appointment.
Okay, thank you.
Okay.
Thank you, Doctor.
All right. Okay, thank you.
No.
No. But
I'm in here. Come and take a seat.
Thank you.
Right, mate, what can I do for you?
I've got a problem. I think I'm getting like some kind of flu or illness. And the biggest problem is my throat because I feel quite a big pain when I'm trying to swallow.
How long has it been like that?
About 8 days now.
8 days?
Yes, I've been taking some tablets, paracetamol recently.
Stand up for me. Open up wide. Dreadful. Yeah, I agree.
Obviously, I just come back from the holiday.
I'll have it.
I just start feeling really, really bad.
Have a stand up for me again. Just want a quick feel. Are you coughing much or not?
No, not too much now. I just feel the pain when I try to swallow.
Your throat is really swollen, it's really inflamed, and you're developing little bits of pus on the back as well. So you're getting like a tonsillitis, if you want to call it that.
Now, so it's a bit better.
Okay, let's have a quick listen to your back. Okay, deep breaths through your mouth. In and out. And one more. Good. Okay, pull that down. Let me just take your temperature. Yep, so you got a high temperature. Your throat looks terrible.
Thank you.
That's the good part.
That's a good part. Okay, what's the bad
Okay, the bad part is we can do something for you. Okay, this always starts as a virus, but sometimes when you start getting all these bits at the back, then we think you may have the bacteria on top. I'm going to give you an antibiotic for that because I think it will help. Yeah. I want you to keep going with lots of fluids. You must drink a lot because you're losing fluid. Yeah, you're losing fluid because you're so hot. Okay, you're sweating and things like that. You can buy all sorts of things over the counter, Difflam, things like that, which is quite good to gargle with because it will help with some of the soreness at the back of the throat. Or you could just take plain paracetamol or something along those lines. Yeah.
I'm all the time taking the paracetamol stuff.
I think you may because it will bring down your fever a bit. It helps for a while and then it comes back again. You're not allergic to anything?
No.
No. I want you to take 2 of these tablets 4 times a day, okay, and that will last you for about a week, yeah? And we'll see how you get on.
Can I buy them in the pharmacy over here?
Was it a good holiday, or did it rain all the time?
No, it was quite good. The last 2 days was nice weather, as you can see on my face. Because I went to sleep on the beach. So
Oh, did you? Very good.
That's why my legs also are so red, you know?
Yeah, another reason why you're hot, mate.
Probably. Thank you very
Try
much,
that.
sir.
Okay.
Okay, have a good day then, yeah?
See you later, bye-bye.
Cheers.
He's a little devil. My cat.
Your cat?
The cat bit me and it came up really high last night. And he catches a lot of rats. It was all puffy through. But it's full of scars with him.
So have you had a tetanus injection lately?
It's been a long time, I think.
Yeah, it is definitely. 2004?
Oh, it was. I think that's when my other cat, I was playing with him, scratched me in the eye.
2004 is when you had the tetanus, yeah. So we can do that today and some antibiotics today. Yeah? So just give me a second. Yeah, just wait for me there. I've got Dr. Aaron here
Let's
to have a look.
Oh, yeah. That's where they always get you.
Yeah.
How old's the cat?
He's 10.
Yeah, and then the teeth carry quite a lot of bugs when they get older. So we need to cover it with what we call a broad-spectrum antibiotic, which is augmentin. Are you allergic to any antibiotics?
No.
Okay, so let's do it now and I can sign it. If the swelling gets worse, if you get any tracking up your arm, we need to know.
Okay. Devil in here.
All right.
And
Take care.
And I'll grab the vaccine.
Okay, thank you.
All right.
Yeah.
Bye.
Devil.
You take care. Okay, you're welcome.
All right. Take care.
Bye-bye, Adriana. Nice to see you.
Bye.
See you then.
Fingers crossed.
Yes, very much so.